There are several things that providers would need to be prepared or aware of prior to wanting to deliver this particular EBT. Those would be you're comfortable working with caregivers closely. A lot of providers haven't worked as closely with caregivers as you do in this model, where the caregiver is involved in every session. Sometimes it's difficult for providers to be on the other side of a child. Say that a child has experienced trauma, and now you're working with a child that may have actually initiated that behavior with another child, and that can be a very difficult shift for a provider. But one of the things that I would also highlight is that this particular model, the treatment outcomes and the benefit you see is pretty quick within the model. So there's a lot of really good positive reinforcement for the clinician in this particular model very quickly early on, where you'll see those benefits within the first month or two of treatment. One of the things that we share with providers is to remember that these are kids also. These are not many adults. These kids do not go on to become adult sex offenders. In fact, they respond beautifully to treatment.
The advice that I would give for any provider is, much like any other evidence-based treatment that you're providing, is be aware of your own biases, be aware of your own stuff. Right? You have to be aware of that, because delivering this treatment can be difficult. There are parts of the model that can be really difficult for the parents, can be difficult for the kids, and so you always want to make sure that you're having the checks and balances within yourself to make sure that you can effectively deliver the treatment.
There's a lot of misinformation out there about children who engage in problematic sexual behavior, and to be aware that a lot of their work is going to be correcting some of those myths and educating the community, but also educating the child and the family and instilling hope in particularly parents who have kind of gotten into a place where they've lost a lot of their hope, and who have been just really jarred by a behavior that, I think people kind of freak out when they hear that a child is engaging in. Building relationships with community partners and stakeholders is really important, and just being aware that a lot of their work is going to be educating and then providing and instilling hope where there hasn't been. Being aware of how they're going to structure time and what time they're going to have groups, and how to have time for preparation for groups, but also debriefing for groups on the back end, so that their team is really solid, and providing this treatment to kids is important. This treatment, when compared to what we have historically done with these children, which is, remove them maybe from their home or place them in therapeutic homes or residential facilities most often, is a much bigger expense and a bigger trauma for the child and the family than having them engage in this treatment. And so that's one of the biggest benefits that I think outweighs the time and the energy that it takes to get this program running.
So I recommended that individuals join a learning collaborative with CCFH simply because of the support. I've done trainings before, but at CCFH you get so much support to make sure that you have everything you need to effectively deliver the treatment. The amount of knowledge and people that are in your corner that can support you through the treatment process or learning collaboratives is amazing.